report, and I would like to present it because it's innovation in dentistry area. So you may pass. I don't know. You may pass. Yes.
Yes.
I'm just showing where Angola is. I'm African too. To say the truth, I just passed through this congress representing Brazil because I was born in Brazil, but I grew up in Angola. Now I'm based in Angola. So that's why I'm showing my country, my second country. Yes, you may go on. Yes, you may go. In this table, I'm just showing everybody a little of Angola facts like the population, the area, major language that is Portuguese. We speak Portuguese too, and life expectancy and tourists. Next. Yes, in the summary, I just want to introduce what is diatomite and zircon fuel. That is the resin that I'm going to use in this case report. And I'm going to explain a little bit more about zircon fuel. And then I will finalize with the case report and the conclusion, including the bibliography. To introduce, I just want to know that regarding the evolution of the restorative materials, the relentless search for dental aesthetic and the need for immediate result by patients, that leads the dentist to apply sophisticated techniques and accessible to all patients. Now we are facing a time that we have to do a dentistry for all, not for only that have much money, but for those that have less money as well. As a result, there was an increase of aesthetic demand in dentistry, the search for better quality and durability of composite resin restoration. That's why I chose Zircon fuel to speak about this kind of difference of better quality and durability restorations. Zircon fuel resin has a differentiated material that calls diatomite. Diatomite is also known as diatomaceous earth, is the naturally occurring fossilized remains of diatomace. Diatomace are single-celled aquatic algae. The diatomace is each deposit contain different amounts of or silica, depending on the age of the deposit. So in other words, diatomace is like a group of silica. And the diatomite, despite being a kind of silica, has a peculiar individual structural characteristics. You may pass this one. This slide is just showing the producer explanation about diatomite and how it works and how it was included in the resin composite. Yes, you may pass. And to complete this explanation, I want to say that diatomite, despite being a kind of silica, has a peculiar individual structural characteristics. You may pass this slide, please. That make it different. Why this diatomite is a little bit different of the other silicas? Because this diatomite has porous, and according to the producer and the fabrics of diatomite, either that this is a natural product, we can see that there in the figure that the natural diatomite is like is bigger, and then this image is showing the transformation of natural diatomite in high temperatures to diatomite powder. To say the truth, the useful diatomite in dentistry is diatomite in powder that we add it to the resin composite. So we have many types, or we have many formulas of diatomite, but the useful or the more useful in dentistry is the powder of diatomite. And to continue, I'm going to show you in next slide the usage of diatomite. You can see there that we can use diatomite in many areas, in many industries, to make explosive, filtration, abrasive things, pest control, thermal, catalytic support, agriculture, and you can use as well to marker and livestock nutrition experiments and in construction. And now we are using also in dentistry, not only in resin or in composite, but we can use also in alginate. This image is showing a figure of diatomite microscope view that shows the pores that this kind of natural material has, that gives a differential characteristic to the another silicas. As I said in the beginning, the diatomite is like a group of silica, but the difference between this one and the others is that this type of silica or this type of group of silica has porous, and this type of porous allow the material to be more skin crash reducing and to have less polymerization contraction. You may pass. And now you can see how we can use it in dentistry. This is Zircon composite. Zircon composite is a composite from Technil, and it was analyzed by Isabella Pinheiro, that is a Brazilian dentistry that discovered that we can add diatomite in resin composite. And why we are going to use this kind of natural mineral in the resin composite? To have a best setting sharing index, high mechanical resistance, because there is a few studies that shows that the adding of diatomite can hide the mechanical resistance. And we can also see superior degree of monomer contraction, excellent workability, and surface roughness. This kind of workability, I'm going to explain a little more, because this kind of workability is one of the biggest difference between this resin than the others. And it also has excellent optical characteristics and superior mimetic properties. Shade system comprises of 4 transverse levels, and we are going to see this in the next slide, that we are showing the type of or the colors that are presented in Zircon composite. And it has a serum with 4 grams. This thixotropy, this word is a little bit difficult, but I'm showing this because thixotropy is a characteristic that has in this Zircon resin that gives it, a good workability. What kind of workability I'm talking about? I'm talking about the time that we have to manage or to arrange the resin on the teeth, the patient teeth. Normally, when we are working with the resin, we have to take care of the light, because the time to work with light is reduced. But when we are talking about Zircon field, we more time that we are pressing them, more than it becomes soft. In this presentation, we are going to see that Zircon field has 4 types of presentation resin, like translucent, enamel, dentin, and opaque. And one of the biggest things in this resin is that we can use for almost teeth. In the next slide, we are going to see as well the type of resins, the colors that we have. So we have a color system table there that shows the type of opaque resin, dentin resin that starts to the A to D, and enamel starts to the A to E, and this E is E/H, medium and high, and translucence that has T neutral to T gray. Why T gray? Because normally we follow the Vita scan. You may pass. And then, what kind of indication that we have to use this kind of resin? We can use in anterior restoration, posterior restoration, veneers, inlay, onlay, core built up, class 1, 2, 3, 4, and 5. So we are speaking about the one resin that we can use for all the teeth or for all the tooth. And in discussion, we are going to see few studies that they are speaking about. You may pass in the last slide. We are going to see some of few studies that I found speaking about Zircon composite. And in this slide, we are showing that the composite of resin Zircon nanohybrid shows in its composition a differential that is diatomite. And what is the difference there? According to the manufacturer, in all analyses, a Zircon resin is more resistant to compression than all other materials of the same clinical application. And however, this pattern was not observed in this present study. This study shows that unfortunately was a different the mechanical resistance wasn't different between the other resins. I'm going to show another study in the next slide. Please, next one. That's other study that speak about the color, the legibility of the color of Zircon resin, that shows that when immersed in wine, the content of time the resins with coloring substance, as well as the quality of polish, interfered in the superficial staining of the stud materials. That stat shows that the composite of Zircon has more color stability than the other one, that was the Fieltech Z 250. This type of comparison of the color stability was good to show that in this kind of resin that has diatomite, we have more color stability than others, because color stability is one of the biggest problems in the restoration in anterior teeth. And to conclude the discussion, I have one of articles that are speaking about the means and standard deviations of sorption for the volated resins, and means and standard deviation of solubility. Why solubility? Because in the beginning of the presentation, I was showing you that diatomite have porous, and this kind of porous have or improve less polymerization contraction. So in this study is showing that the resin with diatomite load showed values of sorption and fractures to toughness similar to others tested and less solubility than others. In my case report, I'm going to speak about a family patient whose present desire to rehabilitate her smile, and I'm going to use Zircon resin to make the restoration. And the case report, in the next slide, you're going to see that clinically the patient has conoid lateral incisor teeth and canine to canine diastems are observed. In the present clinical case, I'm going to use only resin composite. That will be the Zircon composite. In the next slide, we are going to show the finishing, the polishing case and the final photo of the case. I don't know if everybody is seeing very well, but if you can, please go back to before. No, not this one. Yes, before. If you can see better in the first slide in the case report, you're going to see that the patient showed a lot of datum between canine to canine and also conoid lateral incisors. So in the next one, you're going to see that I closed all the diastems and I closed it canine to canine because the patient said that she wasn't able to do an orthodontic treatment. So this can be a quick result that we can do in one meeting. But we can explain also to the patient that the other way to resolve it is using orthodontic treatment and then aesthetic treatment. And to finish, the patient sent me the 4 months after finish the treatment in her wedding. You may pass. In her wedding, smiling with her new smile. So this is my team. You may pass. This is my team. We work in Angola. We are. You may pass. Next slide, please. Yes, we work in Angola. I'm teacher from private university of Angola, and this is my team from the clinic of dental, Catedral Dental Clinic. And to conclude, we conclude that more case reports and more longitudinal studies should be performed. In the next slide, we are going to see the conclusion. And therefore, according to Feitosa, we can see that yes, Zircon has a little bit more characteristics that improve the properties according to the production and according to some studies. And we have to know that aesthetic direct restoration is a relative inexpensive dentistry solution, allowing to recover the natural beauty. But we have to require great professional skills to have good results. Thank you for the attention. In the next slide, you can see the bibliography, and thank you for the attention, for staying to the last presenter. This is my email for contact. And once again, thank you for the invitation. I'm so glad to be